Hi, I'm Dr. Bhargav Rao from Pathofast Lab Pune, and in this video I'm going to tell you everything you need to know about the nucleic acid amplification test slash polymerase chain reaction for the dengue virus. When is this test done? What is this test? How is this test done? What are the main uses of this test? And everything else that you need to know about preparing for this test, I'm going to tell you in this video. To start with, a little primer about what is dengue. Dengue is a viral infection which is transmitted from the bite of the mosquito. It usually causes a very high fever in the first 3 to 7 days, after which the fever tapers down, and around 2 to 3 weeks after the infection, everybody is almost back to normal. There are 4 types of dengue viruses, and this is where the PCR test comes in to help us know which type of dengue you are diagnosed with. What is a PCR test? It's also called the polymerase chain reaction. It basically identifies the RNA or the ribonucleic acid of the dengue virus which is present in your blood. Because it is able to directly identify the dengue virus's RNA itself, it is considered to be the gold standard for identification of dengue. What the test does is it takes this RNA, it converts it into DNA, then amplifies or multiplies those number of DNA and is then able to easily detect them. This is the basic principle of the polymerase chain reaction. It is a highly sensitive and specific method for the diagnosis not only of the dengue virus but all other kinds of viruses, antibodies, etc. Who should do the dengue PCR test? Any patient who is suspected of having very early dengue infection should consider the test. The test is only of any use in the first 3 to 7 days of the fever. Individuals which are having a very strong reaction to dengue, which could be the hemorrhagic fever variant, very severe headaches, severe body pains, or other manifestations of serious dengue, can be considered for the test, especially those people in whom maybe the NS1 test is already negative or the IgM is negative but the doctors still suspect dengue. Those are very good candidates for this test. Other than that, it is usually used for the serotyping of the dengue. That is, there are 4 types of dengue viruses, and the PCR is the only way for us to know which type of dengue you currently have. When is the best time to do the dengue PCR test? Well, as per literature, the best time to do the test is in the first 5 days of the fever, usually within the first 72 hours. After that, the viral RNA levels could drop because the patient will fight against the virus and kill it. And so the best time to do the test is in the first 5 days. How is the RNA PCR test for dengue done? This is a simple blood test. A sample of your blood will be collected by inserting a needle in the vein of your arm. The blood will then be transported to the lab where it will go through a series of steps. The first step is usually called the sample extraction step. This usually takes 1 or 2 hours. Thereafter, there is a phase called reverse transcription in which the RNA is converted into DNA, and then that DNA is amplified by means of an amplification step. The real-time PCR technology is able to do all these steps in one chamber, in one reaction chamber, without having to transfer the sample. The results are available usually between 4 to 6 hours in some labs on the second day itself. How long does the dengue PCR test take to provide a result? Real-time PCR technologies are able to provide you with this result within 4 to 6 hours. The sample extraction phase takes a couple of hours. The reverse transcription and amplification and thereafter the detection could also take a couple of hours. Usually you will have the report either on the evening of the same day or on the next day. What is the normal range for the dengue PCR test? The normal range for the dengue PCR test is negative. The dengue virus should not be detected in your blood. If it is detected, the result will be positive, and that means you are currently infected with the dengue. The dengue PCR test will also give us a serotype of the dengue between 1 to 4. It will tell us which exact type of dengue you have. There are 4 types. So these are the 2 pieces of information that we can get from the report of the dengue test PCR result. How accurate is the dengue PCR test? Well, this is considered to be the gold standard to detect the dengue infection. Its accuracy, that is measures like sensitivity and specificity, are usually above 98 to 99%. Not only that, but depending on the kit, it can detect a very low number of the RNA copies per ml of your blood. Based on one kit, they could detect as low as 7 RNA copies per ml of blood, which is an extremely low number. So the test is able to detect the smallest amounts of the dengue RNA in the patient's blood. It detects all the 4 types of the dengue viruses, which is very important because that is used in research as well as for epidemiological studies and to know which is the type of dengue that is spreading in the community. So all in all, this is an extremely accurate and reliable test.